Welcome, everybody. I'm so delighted to have you here with us. My name is Anna Valdez. I'm the editor-in-chief of the Journal of Emergency Nursing. I've been affiliated with the journal for 19 years. It is a love of mine to be able to do this work. My experience, I have 20 years experience stretcher side as a full-time as an emergency nurse, and I currently work as professor of nursing at Sonoma State University. And then I'll just hand it over to Maddie to introduce herself.
Thanks, Anna. My name is Maddie Whalen. I am the Evidence-Based Practice Program Coordinator with the Johns Hopkins Health System. In my role, I have served as the editor and author on the fourth and the brand new fifth edition of our Johns Hopkins EVP model. And I'm also a section editor on our new column that we're starting in the Journal of Emergency Nursing on public health. So I'm very happy to be here. Thank you.
Thank you, Maddie. We'll go ahead and get started. Just so everybody knows, I can't see the chat while I am talking, but we will be looking at it and I'll respond to you as we can when we get to questions. So I have a couple of objectives because I am planning to put this in EN University and hopefully be able to offer CNE for it. So we're going to talk about the importance of sharing knowledge and experiences in emergency nursing. We'll identify some different types of clinical articles that are accepted in the Journal of Emergency Nursing and help you have an understanding of why something might get accepted or rejected. And then I'm going to identify some resources, including reporting guidelines that are there to support you as authors. One of the comments that I got for this is that they really wanted to know how the bedside nurse prepares to be able to publish a paper. And so I will work on giving you that information as well. So first, why publish? First is to share your experience and insight. If you are actively working in the emergency setting right now, you know that a lot of the nurses that we have are new. They may be new grads. It was unusual for a new grad to come into the emergency department when I was a young emergency nurse, though I did it myself and certainly can do that successfully. But there's a lot of opportunity for growth and learning. There's a larger number of advanced beginner nurses, and you have the opportunity to share your experience and insight. And particularly when you have an unusual case or something that is new, a different approach, some sorts of innovations that you've come up with to improve patient care, improve the nurse's experience. It's great for professional and personal growth. If you've authored before, then you probably have the same experience that I did when my first paper was published, of being really excited to see a paper that's published. It leaves something of you to contribute to emergency nursing. Like I sent mine to my mom and dad. It was very exciting. And it helps us to advance emergency nursing. And we're talking particularly about clinical papers because when I started 2.5 years ago, one of my goals was to increase clinical papers, and there are more clinical papers in the journal, but I would still like to see more, and I know that our readers are really interested in that. And so we're really trying to keep a balance between research, knowledge generation that will guide your practice, and also clinical articles that you can apply in practice that day. And I know when I was working in the emergency department, those clinical articles really mattered to me because sometimes they were things that I had never seen. So how do you get started? First, there are some questions you have to ask yourself, like, what do I want to write about? Have you had a unique experience, something that's innovative? Maybe your team has done something that's really improved patient care. Maybe you're seeing things that are new or unusual. There are cases that you might want to share. So what experience or cases or approach could help inform colleagues around the world. Jen is an international journal, and so you will see that there are articles from around the world. How can we help our colleagues and share information? And then what are your strengths and opportunities for growth? How comfortable are you with writing, and what sort of things do you need to be able to feel confident in writing? One of the things that I often say is for newer or aspiring authors who don't have a lot of experience, partnering with somebody who has experience is a great way to publish your first article. I had a lot of mentoring with my first article, and we'll talk about section articles as well as a way for you to be able to get mentoring. And then what type of writing do you enjoy? Do you like creative writing? Do you like more scholarly writing? That will help you to know whether writing for Jen is ideal, or maybe writing for a magazine or a blog or things like that. In general, Jen is a scholarly journal. Sometimes people get confused and they'll call it a magazine. Connection is our magazine, and that's where we put papers that are not peer reviewed and don't have to meet the rigor of an academic journal. But at Jen, we have a balance of maintaining clinical papers, but also the rigor of what is expected from a scholarly paper. And like I said, do I need a mentor or other support? And even if you're a strong writer, having somebody who has experience, who's willing to look at that paper for you and to give you feedback is incredibly helpful. I also think if you identify the type of paper you want to write, that downloading and saving a couple of recent articles that are in that same section or the same type of paper is really helpful. That was really helpful to me when I did my first major paper, was to look at some other articles that had been published that were similar. I did a literature review to serve as a guide. And obviously you don't want to use the same language, but to be able to see how they organized the paper, how it flowed, really helped me because I didn't have that experience. And then there is on the Jen website a writing for publication webinar. There are also two editorials, one that I did for writing for publication focusing on largely on doctoral projects. But the writing for publication is for everybody. So I'm not going to discuss all of the steps of writing for publication because that is in the webinar. It's an ENA university. It's also right on our website, and you guys can take a look at that. So you want to do a little bit of reflection before writing, because you don't want to spend a lot of time writing something that's not going to be accepted. So things to think about is, has the clinical topic that I want to write about been published already? If so, how has it been published? Do I add something, or can I add something that is new or that fills a gap in the literature, or maybe addresses a problem that we're experiencing in emergency nursing that hasn't been addressed? If something's been published on it, that doesn't mean that you can't write about it. But if there have been several articles that are published, or there are articles published that would say the same thing that you want to communicate, it's not likely to get accepted just because it doesn't fill a gap. Importantly, will the paper impact emergency nursing practice? That's one of the questions I ask myself every time I look at a paper that comes in, is what is the impact for emergency nursing practice? Sometimes for the patient-facing nurse, it may not seem that the paper impacts, but I know that it's providing evidence that will ultimately guide practice. But that's a really important one. And I think it's important in that most of the time we want to write about things that we're passionate about, right? Like I loved caring for pediatric patients. So, I might be inclined to write about pediatrics. So I need to make sure that what I'm writing isn't just what interests me, but also that it would help to guide practice. And then who's the audience for your paper? Who do you want to read it? At Journal of Emergency Nursing, the people that you should want to read it are emergency nurses. And our philosophy is that the journal is for all emergency nurses that practice in any setting and in any role, from a early career nurse to advanced practice nurse in any setting. And then, is Jen the right journal for my paper? Is it really focused um, on practice as it relates to emergency nurses, or might another journal be better? Like, for example, I get a lot of papers about nursing students, which is great, but it doesn't affect emergency nursing practice. And so, think about if Jen is the right journal. And sometimes you might want to get started with a blog or something smaller. We have a section called Impressions that I'll talk about for those of you who are creative writers. If you're not sure, you can send an inquiry to an editor for guidance. That's generally true of all journals, though not every editor responds to inquiries, particularly those that get thousands and thousands of papers. But I do respond to every inquiry, so you can write me and say, I'm thinking about writing about this. Is that something that you'd be interested in? Please know, though, if I say, yes, that's an interesting topic that's relevant to emergency nurses, and sometimes I'll give some guidance about what to include, that does not mean that because I said we would be interested that we'll accept it. At the Journal of Emergency Nursing, every paper goes through blind peer review. So first I look at it and see if I think it is publishable. And if so, I assign it to an editor, and then they assign peer reviewers. So do know it can take a couple of months to get your initial response. Peer reviewers who look at your paper will not know who you are, and you will not know who they are, but they are all experienced emergency nurses. So let's talk about the types of clinical publications. Under the umbrella of full-length articles, we do have general clinical, which are generally updates to practice, right? For example, when there are changes in sepsis management or congestive heart failure, or recently the American Heart Association made changes in terms of the treatment of elevated or hypertension in emergency or clinical practice. Those things that are new are helpful, new updates, things that can inform practice. You may or may not know that the time from evidence being generated from research to the time that it's fully implemented in practice can be up to 15 years, right? So if there are new updates, especially in areas that you're excited about, because it's always easier to write about things you're excited about, then those are a perfect way to get started. And I'll talk specifically about these types. We also do quality and performance improvement. A lot of you are doing performance improvement projects in your emergency departments. We do publish evidence-based practice projects, which Maddie will talk about. Her and her team developed the reporting guideline for that, so I'm very excited to have her talk to you about that. Clinical science translation, I'll share a little there. Probably not your first choice as a newer or aspiring author. And then shorter articles, which are often a great way to get started. It's where I really gained confidence as an author. Section articles, we have images and impressions, and then letters to the editor. And we'll talk about each of them. So full-length clinical articles should expand on previous knowledge or provide updates. Again, when new reports or changes, new protocols for care come out, those are a good source to be able to expand on previous knowledge. Must have implications for emergency nursing practice. I often get papers submitted that are emergency related, right? Like layperson CPR or layperson response to emergencies, but they don't impact emergency nursing practice. And I really try to keep that focus so that what you all are reading is really important to you. All of these really require a literature review component, which means that you've got to talk about how you searched the literature and what you found. And again, looking at some literature reviews is helpful. Um, must be informed by current evidence. So one of the things that's really important is that the references you use are current, and that generally means 3 to 5 years from publication. Because keep in mind, the time we did that study, it may take 3 years before it's published, right? So we don't want to be basing our practice on things that are 10 or 15 years old. One of the areas where I see the most challenge with this is when people are describing a problem, like this is the reason why I'm writing this paper. And every paper really should have that, that beginning of why is it important for this paper to be published and how will it impact emergency nursing? What problem is it addressing? And so if you're talking about the prevalence of something or the current issues or problems, you need current data to be able to show that. We can't talk about, for example, ED boarding and use data from 15 years ago because that's not reflective of where we are today. Sadly, it probably is. We have not progressed as well as we would like to, but we really need to have current information. So clinical articles can include specific assessment approaches, diagnoses, labs, medications, etc. It's very important that those are accurate and that you do your due diligence. The editorial team will do that as well. But pay close attention to those. If you're using a particular brand and you have outcomes with it, that can certainly be shared, but we can't publish things that are promoting a particular product. And always use caution if you've developed a product or a resource that probably if you're writing about that product that you developed, that may or may not be published because there's a conflict of interest there. So again, that might be something that you send an inquiry about. I'm really looking for clinical articles to aid in the development of clinical judgment and critical thinking. In my experience on the other side of the rails, we have become in healthcare in general, not just the emergency department, very task-based, very diagnostic dependent, meaning that we're relying on diagnostic studies and labs and results to guide us in our practice. I have noted significant issues with, people not getting assessments, things like that. So we really want to help nurses, particularly our evolving nurses, our young or early career nurses in developing clinical judgment, critical thinking, to be able to think about differential diagnoses based on their assessment and anticipate the care that they're going to need rather than going from task to task. And so I think that's one way how you can add to previous knowledge or add to knowledge in general. And we do have a section specifically for early career nurses that can be used for things that are relevant to our colleagues that are in their first few years or first 5 years as an emergency nurse. Usually these are not more than 3,000 words, including the abstract and references. If it's necessary, if the content that is there is all helpful and not redundant, I will sometimes go over that amount. And we use less than 5 tables or figures and less than 50 references. Generally, a full-length paper is going to have a fair amount of references, but we don't want it to be pages and pages. So performance improvement, we do get a fair amount of performance improvement papers, but I think there are more out there that could inform practice. So generally, a performance improvement or quality improvement paper, you can use those interchangeably. They focus on a local problem. So in your health system, in your emergency setting, in your air ambulance group, there's a problem that is happening, right? It may be timing that, things are not getting done as fast, antibiotics are not getting started as fast, or whatever it may be. It may be that you have, that you are trying to reduce overdoses in people with substance use disorder. It could be anything that is a local problem. So you focus on that local problem. And again, provide us with information on what you are seeing and what problem needs to be addressed. It usually uses a theory or model to guide the project, like PDSA or other ones. Lean, I'm not a huge fan of lean because it's more of a manufacturing one, but it is used. But some type of theory or model that guides the project includes evidence-informed intervention. So Maddie's going to talk to you about evidence-based practice projects where you are determining recommendations based on the evidence. In most performance improvement projects, you are taking the evidence that exists for best practices and applying it within your setting to try and improve the problem. Importantly, it evaluates the impact of the intervention. So a performance improvement project is going to have an intervention, right? You're going to identify the problem. Maybe you have a lot of patient falls, and you're going to go to the evidence and the recommendations that exist. You're going to decide what you need to apply in your setting, or what you're already applying, or how you might need to tweak it to improve those. You're going to implement that intervention, usually involving education and policy change and those kind of things. And then you're going to evaluate the impact, right? So does it work? Now, sometimes people think because the intervention was not successful that it's not publishable. And in fact, that's not the case. I'm very happy to publish research and performance improvement that it didn't work, right? Because that's really helpful. If I am in my emergency department experiencing the same problems with falls that you are, I can look and see why you feel like the intervention didn't work, and I can try a different approach and not spend time replicating something that is, not going to be successful, or maybe could be successful in my environment, but there are reasons why it wasn't in yours. You want to have recommendations for replication. So if you're going to implement this, I would suggest doing this because this was a challenge for us. Or if we were to continue this or do it again, we would add this. I think those are really helpful for us to be able to identify how we can share those experiences, both things that work and that don't work. And then really importantly, performance improvement projects are not research studies. A lot of our performance improvement papers come from doctoral projects, which is fabulous. I love that. But for some reason in academia, we often will kind of interchange the word study and project. You don't want to do that. If you are doing a project, you need to call it a project throughout, not a study. And the reason is, one, it helps to not confuse the reader, but also when peer reviewers look at it, if you present your performance improvement project like a study, they're going to identify and share concerns about rigor and elements of the study that are not included. So you want to have your peer review be based on the project that you did and to align with performance improvement so that they can see that, yes, you have addressed all of the information. Performance improvement projects require an ethics statement. So you can either have IRB approval or exemption. That's usually very common in doctoral programs or graduate programs. Or you can include a statement that based on the policy at your healthcare organization, your hospital, that IRB was not necessary. And then we'll talk a little bit about other reporting guidelines, but the Squire 2.0 reporting guidelines have to be used and have to be uploaded. So there's a checklist where you can write where you address those. with these reporting guidelines, that's really a gift because it's like an outline for your paper. So you will go through it and you want to write in chronological order, addressing the issues that are in that reporting guideline. Now, some of them may not be applicable, and that's okay. Write not applicable. And if there's a question, we can ask why you felt like it was not applicable. Generally, I would say performance improvement projects it's ideal to have a writing team because it's a bit of a heavy lift. I feel the same way about research. It's helpful to have a writing team to work on that. Just know that everybody who participates in writing, if they're listed as an author, has to meet the criteria for authorship, which I talk about in the Writing for Publication webinar. So these are no more than 4,000 words and 75 references. So we also do clinical science translation reviews, and unless you're an expert in a field, it's probably not the type of paper that you want to do. These are usually authoritative, timely clinical articles that are a synthesis of the evidence or current knowledge on a topic. And it's usually written by experts in that field, people who have published significantly in that field. And these are often invited papers where I identify people who are experts and ask them to write on their area of expertise. Now, you certainly may be involved in this wherever you're working. You may be working with experts. You may be an expert in the field. And if so, and you want to write one of these, I do recommend an inquiry first, just because it's a lot of writing. And I always feel sad when I get a beautifully written paper that I can't publish because, it's already been published. Or other things like that. And people have put a lot of work into it. And then if you are an expert and you're looking at a clinical science translation, it needs to differ from your previous publications, right? You can't write the same thing. It really needs to be a synthesis of everything that is published. And this really informs clinical practice through appraisal of current evidence and highlights gaps in research that we need to address to inform clinical practice. So I'm going to turn it over to Maddie, who's going to talk to you about evidence-based practice projects.
Thanks, Anna. So we recently added evidence-based practice projects as one of the types of articles that can be submitted to the Journal of Emergency Nursing. And part of that was really an effort to make sure that we're getting topics that are really clinically relevant for nurses who are actively working in the emergency department. So we thought this was a great way to give people the opportunity to report their EBP projects that maybe don't necessarily fall into some of the other categories that were previously available. But in the idea of reporting an EBP project, I want to make sure that we're really clear about what an EBP project is and what it isn't. So an evidence-based practice project should be guided by an EBP model. There's many different ones out there. And the project is aimed to address a very specific clinical problem by integrating best available scientific evidence with clinical experience to enact practice change, and then very importantly, to measure the results of any of those changes. One of the main parts of an EBP project, the E of the EBP, is the evidence. And so all of these submissions need to have a thorough review of the literature using a systematic approach. And that's to make sure that their actual recommendations are reflective of the state of the evidence on a topic. A lot of times, maybe in school or in maybe some of our nurse residency programs, we're told we need, 5 articles, 10 articles. And there's not a predetermined number of articles that make something an EBP project. An evidence-based practice project is, in fact, reflective of the evidence when it systematically gathers that information and doesn't reflect the bias of the authors as they sort of move through all that information. So the evidence portion of the EBP project really needs to reflect a systematic, unbiased review of the literature. So we're really clear that what those recommendations are in fact based on the state of the literature. And then, like I said, those recommendations need to be put into practice. So they should include implementation and evaluation of those best evidence recommendations that have been determined in the E portion of the. Oh, next slide. I was like, my slides aren't working. And I can give you my next slide. Thank you. Okay, so another very new thing is the evidence-based reporting guidelines. So like Anna just talked about, we have the Squire 2.0 guidelines, which I think they've been around for a while. They might sound familiar to a lot of people, but until about a year and a half ago, we didn't have any guidance for reporting evidence-based practice projects. In fact, in the repository of evidence of writing guidelines, out of over 600 writing guidelines in that repository, 0 related to reporting an evidence-based practice project. So a group that I work with sort of saw this as an issue because they both threatened the quality and the quantity of these EBP projects that are appearing in the literature. And we did a research study to figure out basically what are the essential items needed to be reported on an EBP project so that the reader has full confidence in what the authors found and perhaps can even translate the findings into their own setting. So as a result of a research study, we came up with the EBP reporting guidelines. They are linked here, and they're also on the Equator Network. If you just type in EBP, it should be the first thing that comes up. And as part of this, we now have 6 headers and 30 subheaders. I'm not going to read you all 30 subheaders, but I do have the 6 headers here. And most importantly, one of the really big goals of this writing guideline was to sort of give people a roadmap to how to write a project, especially people who are newer to writing. So if you open up the reporting guidelines, not only does it have the header and the subheader, but it also has some italicized text that tells you exactly what you're supposed to put in each of those boxes. So we're really trying to make it as easy as possible for people to write up their findings, especially people who maybe this is their first or their second time writing a paper. So not only does it have those headers, but it has instructions as well. And everyone loves some good instructions. Next slide, please. And then finally, I just wanted to mention one of the other sort of gaps in the literature is there haven't been, as far as I know, there aren't any writing guidelines for writing up an integrative review. The Whitmore is sort of, if you guys have heard that name before, they wrote a paper in 2005, them and a colleague, about defining what an integrative review is. And essentially, when you're doing an EBP project to determine the evidence phase or determine what the evidence is saying, you're essentially doing an integrative review, which is a scientific method to gather both theoretical and empirical information. So basically, scientific information as well as things like expert opinions or things that are more theory-driven. So they have this great seminal paper about what an integrative review is, but there isn't a writing guideline that goes with it. So some people really struggle to figure out, where do I put my number of results? Is that in my results or is that in my methods? Where do I put my synthesis of findings? Is that in my results or my discussion? So we're also recommending that people can use the EBP reporting guidelines as a reporting guideline for the integrative review if they didn't implement yet by simply omitting the implementation section. So everything leading up to implementation tells you how you got to the eventual best evidence recommendations, and you can use that same guideline to describe your process and simply omit the implementation section and then move on to your conclusion. So this is, this isn't an official recommendation from Whitmore and colleagues, but it does talk about the process for generating those recommendations, and this serves as a good roadmap for that type of paper as well. Thank you.
Thank you, Maddie. And one of the things I love about the evidence-based practice project reporting guideline, as Maddie mentioned, you can stop at implementation. So for some people in graduate school, they're just making recommendations based on the evidence. And other times they may be implementing that. It's really helpful, I think, to look at those, though, if you're writing a clinical paper, because we're going to ask you to talk about what the problem is and then talk next about what the evidence is, what a literature review has shown you. And so while it might not be as comprehensive of a literature review as like a systematic review or integrative review, following those guidelines is helpful in terms of being able to inform the reader about the evidence that you're drawing from as you write a clinical paper. So we'll talk about section articles. I'm not going to talk about all of these, but these are the different sections that we have at Gen. We have a lot of sections, and the reason is that we want specialized areas that affect emergency nurses. And the goal of section articles is really twofold. It's to provide updates and information relevant to that topic and subject, but also to provide mentorship for authors. So section articles will go through the flow on that, but you work directly with a section editor who may help you to edit, may be willing or able to co-author with you to help you bring a paper to where it's ready to be submitted for peer review. I was a section editor for almost 15 years. It was one of the things that I really loved was being able to work with authors. So if you are a newer author, if you don't have experience or education on how to write for publication, but you have a cool idea or something interesting to write about that falls into one of these categories, then reach out to the section editor and see if they're interested. We did recently just add the public health corner, given a lot of the changes that are happening to public health infrastructure and the significant impact that has on emergency nursing. We wanted an area where we can put updates. Like I'm currently working with authors right now on a paper about measles, since that is an issue that is pressing for us in public health and in emergency nursing. So case reviews are the most commonly submitted clinical papers. They also, based on gen readership, surveys are the papers that our readers enjoy a lot and want more of. So case reviews report an individual patient case while also integrating best practice evidence and clinical reasoning, right? So you present the case, but you also are presenting what the standard of care is, how some of the decisions were made. Usually these are rare diseases or diagnoses or unusual presentations, new treatments or unusual outcomes. And if you've practiced long enough, you'll know that there are some things that maybe you've only seen once in your career. I practiced full-time 20 years. I only saw one child with Kawasaki disease. And I didn't know exactly what it was when I was treating him. I knew he was very sick, right? And so those kind of things can be really beneficial. In the September issue, there is a case review of a patient who had a blood glucose over 2,000 and survived. So those kind of things are really beneficial and help to guide our practice. And even if things didn't go perfectly, describing how you might change that care is good and is helpful to other people. They have to follow the care reporting guidelines. All of these reporting guidelines are, if you Google Equator Network, that's a place, a repository that holds all of the reporting guidelines. So care reporting guidelines, again, you follow in chronological order and address the things that are included. In your letter to me, you need to include a statement saying that you have consent of the patient or family. I don't want you to submit a signed consent because I don't have a right to know that person's name, and to protect confidentiality. And you also can't include any patient identifiers. And you want to be cautious with things. Don't use exact dates, exact times. If the patient has unusual comorbidities or things that might make them identifiable, you want to take those out so that even though that patient or their family has consented, we're not potentially exposing them or harming them from a confidentiality standpoint. If you have a clinical case, like maybe you do simulation or you've had an experience, but you don't have consent, you can do illustrative cases where you can write, this is a, illustrative case, and it's not based on a actual patient. Usually getting consent is pretty easy. I have some unique medical issues and I give consent regularly for case reviews. Make sure that you carefully check meds and labs for accuracy. And also that the care you provided matches the standard of care, or if it doesn't, if there were delays in care or there were other problems, why it doesn't, right? Like I had my first critically ill actual newborn, just born baby many years ago, which made me really good at babies because I did not have the equipment that I needed for that child in our trauma room. And so I really focused on like totally revamping what we had. That's a good example of being able to say, this did not go perfectly, and here are the reasons, and this is what we recommend so that things go better in the future. And then case reviews are submitted directly to the Gen editorial manager. And again, in the Writing for Publication webinar, it walks you through like where you go to submit a paper and what the steps are. Another way to get started, especially if you don't have a lot of writing experience, is letters to the editor. Usually they're not more than 2 pages and 10 references. Generally, they need to be responding to an article in Gen. You could write a letter to an editor about something that's new, a newly released protocol, or things like that that you want to share insight about. But most commonly, you're responding to an article. And that could be, sharing additional information or insight, making recommendations for further research or further exploration, reinforcing the content of the article. So it could be a positive feedback to the authors about the impact that you felt like their article made. It can also be areas where, I would recommend to researchers that you expand on this. Commentary is allowed with that. We don't have papers that are commentary where you offer your opinions, with the exception of letters to the editor. You can offer your opinions, but it also needs to be supported by evidence or scholarly references to support what it is you're saying. And if it doesn't, then I'll usually send it back to you. Letters to the editor are generally not peer reviewed unless there's something that, unless I really want some expert opinion about the content that's in there. And letters to the editor, the authors will also be invited to be able to respond to your letter. But it's a great way just to get started and to get comfortable with reading articles in Gen and thinking about the impact and, sharing what you feel like the impact is. We also have an area called impressions, and these are generally first-person narrative essays. It can be art, poetry. It's for you creative writers out there. And there aren't really strict guidelines. You're going to see a couple impressions coming in September, and then later in November, we have a poem that is being published. I have a first-person narrative about a emergency nurse's experience in the emergency department. So this can be where you share, kind of your experiences on a more personal level. It must be related to emergency nursing, and it should be of interest to Gen readers. So sometimes I get really beautiful like poetry or first-person narratives, but they're not really directly related to emergency nursing. And that's a hard line for me because I know you guys want things that are related to your practice. We also post images. So if there is an unusual finding on diagnostic studies, radiologic studies, forensic nursing types of things, we publish those, and they really are the images or image with a brief description of the case. It doesn't have to follow the care guidelines. It's the description is basically to talk about what it is showing and what it means for emergency nurses. Also has to adhere to the patient consent policy. So there needs to be a note that you have received patient consent. And those images have to be free of any identifiers like a patient ID number or name. All right, section papers. These are usually short papers on a specific topic relative to that section, usually 3 to 6 pages with no more than 25 references. Most of our papers require an abstract, contributions to emergency nursing practice and implications for emergency nurses, but they are not required for section papers. They need to be evidence informed. In other words, you can't just write about your experience. You need to tie that to the evidence and best practices to support the article, right? Especially if you're making recommendations or you're talking about care. For example, the paper that's going to be on measles, the problem is that we have an uprising in measles, and that's important to emergency nurses. And there'll be some experience in terms of this is what you do, which is all founded on the evidence that's available to us. So with these, you reach out directly to the section editor. Their emails are included in the author guidelines. Again, that writing for publication covers all of those things, that webinar. So you'll email the section editor and see if they're interested. If you have a paper, you can send it to them. If not, you can write them, kind of a brief outline of what you're thinking about and see if it fits in their section. If they are interested, they will work with you. And there are a wide range of how they can work with you. If you haven't written and you want support, you can always ask if there's somebody who would co-author with you. Sometimes section editors will do that, or they have colleagues who would be happy to support that. And you can also write on your own or your own team, and the section editor will offer you feedback on how to edit that paper to make it ready to be able to submit for peer review. Section papers are peer reviewed, so you'll get feedback. So even if the section editor said, yes, it's ready to go, it doesn't mean that it's going to be accepted. It still has to go through peer review. But we certainly try and work hard with section editors and the authors that are publishing in their sections to get a paper to accept. We will sometimes publish full-length articles in sections, but that has to be agreed to by the author and editor. And that could include even like performance improvement projects that are really relevant to that section. But like I said, the author has to agree as well as the editors. So the flow of papers, if you're writing one of the full-length papers we talked about, you can start with an editor inquiry email. That is not necessary, but if you want to, you certainly can do that. And then you're going to submit the paper to editorial manager. The manuscript has to not have your name on it for peer review. The title page is submitted separately, and the cover letter is submitted separately. Anything you want me to know as the editor. Cover page is a good place to talk about why you think your paper is appropriate for Jen, because it helps me to see what your thought process is and how it might relate to our readers. So it will come to our managing editor, who will check to make sure everything's there, like your ethics statement, if that's required. And then it comes to me, and I will either desk reject it or I'll assign it to a handling editor. The main reasons why I desk reject is that the paper is not within the scope and aims of Jen, which is largely for us that it impacts emergency nursing practice, or it's important to emergency nursing practice. For example, if you do a study or performance improvement project that isn't focused on emergency nurses, even though it might have something that's relative to our practice, that may not get accepted. Also, if it adds nothing new, if we've published about that topic and this paper doesn't add anything, if there are problems with originality, we do use iAuthenticate to make sure that it is original work. Or if it's not properly reported, like a performance improvement project that doesn't follow the reporting guide. These will be a minimum of 3 blinded reviews generally. And keep in mind that that can take a little while, because we have to have a certain amount of time for reviewers to decide if they're going to review and then to accept that and to do the review. If you, at this point after reviews, the options are accept very rarely happens. I've accepted 2 papers in 20 years without revision. Most common is revise and resubmit. Almost every paper will have that if it's not rejected. And then that's an iterative process. And if you're a new author, it may take a couple of revisions to get you where you need to be, because For me as an editor, if there are a lot of things that need to be worked on, I'm going to give you the main ones first, and then we might need to do a review again after that. So your paper could go back for peer review, especially if reviewers recommended major changes, because I want to make sure that they're happy with those changes. So again, that's kind of iterative until it's accept or reject. If you get rejected, it doesn't mean that it's a bad paper or that it doesn't have value. It just means that either it wasn't adding anything new. It needed a lot more work to be ready. So don't take that personal. So section articles, the flow. First, you're going to contact a section editor by email. It's on our website. And we're currently making some changes to the guide for authors. So it's a little bit wonky this week, but I'm hoping that'll be fixed by the end of the month. If you have questions, if it's missing information, just feel free to email us. So you'll propose your paper and ask for feedback. You'll work with the section editor or editors on revisions. And when they're ready, in your cover letter, you're going to write, I worked with these section editors and they have approved me to submit for review. And then you'll have a minimum of 2 blinded peer reviews. We do 2 instead of 3 because you've already had review of your paper and support from the section editor. And then the section editor doesn't make the final decision. It's based on the peer review. And then if I'm going to reject, I'll usually talk to the section editor about why, or the handling editor will. But it has to be accepted by the editor who's handling the paper as well as the section editor. And usually they do accept papers that they've been working on. So just so you can see where it says submit article, that's where you go. That's under the publish area. And then you can see right below it is the guide for authors. So things you need to submit, title page with your author details for everybody who is authoring that paper. If it's full length, you need contributions to emergency practice. Those are specifically laid out. There's 3 prompts in the author guidelines that you have to address with a single bullet point for each. Again, if it's not a section paper, it needs an abstract. The manuscript should not have any author details on it, and it needs to include a section on implications for emergency nurses. Again, those are explained in our author guidelines. Editorial manager will require you to do a conflict of interest document. We use AMA 11th edition, and you submit at Gen Online. The next webinar we're going to do in August, I'm going to do with one of our associate editors, Dr. Fontenot, who's going to go over tech tools that you can use to make a lot of this much easier. But one that you can use, let's say you have a school paper that you're editing to make it publishable, because school papers are very different than articles, but everything was in APA. I often will use ChatGPT to convert my APA citations to AMA, for example. And you can also do that using Google Scholar and other resources. So make sure you read the author guidelines. They're posted, again, they're a little wonky because they're under change, but that should be fixed by the end of the month. Follow all the guidelines for the paper type. Make sure you read about ethics and AI. At Gen, we do allow the use of AI for things like grammar, checking your paper for flow, making suggestions on how to improve the language in your paper. If you use any form of AI or an editor, you need to disclose that. And there is in our author guidelines, the disclosure statement, basically says, I used ChatGPT or whatever kind of AI to review the paper for writing style and grammar. We do not allow you to submit things that have AI generated writing. So, you can't go in and say, write me a paper that addresses these things. Because it needs to be original work. Make sure there's a checklist in the author guideline. Make sure you review it before submission so you don't get revisions for things that are not necessary. And then commonly missed items, citations to current evidence and literature. That first couple paragraphs where you're talking about why this paper is important, I expect to see the references to be in the last 3 to 5 years, unless it's seminal work, unless it's something that's not been researched in a while. If you're doing performance improvement and evidence-based practice projects, if you're required to have IRB approval, you need an ethics statement. Again, a statement of consent, but not the actual consent for patients or family. And then if you're doing full page or full length, we want to make sure that you've adhered to reporting guidelines and that you've got emergency nursing implications and contributions to emergency nursing. And we include those so that readers, you as readers, can look at the article and see why was this study or practice improvement project done, and what did they find that is relevant to my practice. Common problems, writing issues with grammar, syntax, and spelling. Again, that can be helped with things like Grammarly. I use Grammarly all the time, or AI, or an editing service. Submitting papers that don't add anything new. One of the big challenges is trying to condense the project or dissertation paper. I do have an editorial about this that is actually coming out this month that will help with that as well. And in the writing for publication, I address kind of the differences between a project or dissertation study and a publishable article. Sometimes people try to just like cut and paste sections, and we need original writing, but also what happens is you don't really fully address things and it doesn't flow well. And also, graduate study papers are very redundant. If you've done a DNP project or master's project, research dissertation, you know that you're repeating the same stuff over and over, and we don't want that in an article. Not using reporting guidelines if they're required, and then lack of scholarly tone. So you don't want to be sharing your opinion outside of recommending what is best practice. So with that, I'll stop sharing and bring Maddie back. And I'd be happy to answer any questions. And Nan, maybe you can help because it looks like there's quite a bit here. Let me see.
Yeah, I did put a few down here that I saw. One person asked, who can we send poetry related to emergency nursing?
That would get submitted directly to editorial manager. It comes directly to me. And impressions are not always peer reviewed, so sometimes they just get accepted or rejected by me.
And then I see one that said, let's see, what would a newsletter section count as for a state organization?
You know, those can be blogs or just newsletters. And that's a good way to get started writing too if you're not really comfortable with having more of an academic voice. I think that's a good way to get started.
Okay. Oh, one that just came in there. Are there fees associated with the submission?
No, there are no fees associated with submission, and unless it's an open access journal that requires that, I would use caution if people are saying there's a fee up front. There is a fee that you can pay to make your paper open access, which means anybody can see it. And oftentimes, particularly for researchers who have funding, they want to pay that fee. That's an Elsevier fee, though it's not an ENA fee. But you can publish your papers at zero cost, just it won't be open access for you.
It does say here someone had asked if there's a way to get a copy of the slides so they can use the click on the relative links.
Yes, let me think about how best to do that. Nan, you have email addresses for the people who register.
I do have
Okay.
those.
So we can do that. I'll put that together
Okay.
and then be able to send it out to everybody.
Great. And I am also just letting everyone know that we are recording. So this recording will also be available not shortly. And once I get it edited, and we'll get that posted for you so you can watch any of it again and see all the information on the slides.
I see Anita asked, does transport medicine fall within that? Yes. So
Yes.
transport nursing is emergency nursing. And so flight nurses, nurses that work on critical care ambulances are considered emergency nurses, and we publish things that relate to their practice.
And they're saying thank you in the chat. Um, One, Amy had asked, my coworker and I are interested in writing and submitting. Would you be willing to share your email so that we can float our idea by you?
Absolutely. And I just put it in the chat.
Thank you. It is now in the chat. I think that's everything I saw. Anyone have any other questions they want to ask? Go ahead and put those in the chat. If I missed them, go ahead and re-put it in the chat, but I think I got them all.
So I'll just kind of close with a little bit of information, again, bringing it back to the patient-facing nurse who might want to author. You don't have to be in graduate school or have completed graduate school to be an author. You can get started with section papers and get comfortable with that. You will notice that lots of our authors have been in graduate school because we teach people there's an expectation of publishing at that level. Know what you want to write about. Find a mentor or a co-author, somebody who has published before to help you through that process. Dawn Petta on Facebook has a informal writing group for Jen where people meet and kind of do writing accountability. So that's something you can look for her on Facebook. Look at other things that are published similar to what you want to publish to use as a guide. And don't be afraid to ask for guidance. A lot of editors do not put their direct email out. I do. Feel free to email me if you have questions, and I'll get back to you as soon as I can, or if you have ideas you want to share.
I don't see anything else. I see a lot of thank yous.
Well, thank you to everybody for being here. We will post this, and I will get Nan a PDF copy of this so that you guys can click on the links. I do see some of our editorial board members and section editors in the audience. I want to thank you for being here and for the support you provide for authors. And I hope this was beneficial to everybody.
Great. Thank you so much. Thank you, Maddie. Thank you, Anna. Thank you all for attending. Have a great afternoon. Take care.